Hi everyone, I'm Ann Madden, the founder of Proximity Telehealth and a physical therapist who focuses on pelvic floor function and helping women return from pregnancy back to fitness. Today I'm talking to you about an extremely important topic. This is postpartum complications. So this is things that can happen to women immediately after having a baby. I find that women don't get this information soon enough. So I would love for you to share this with any woman you know who's pregnant or a family member of a woman who's pregnant. Most often we will see that family members will start to see some of these signs before the pregnant woman is aware of it. So it's really, really helpful if everyone around someone having a baby knows that some of these signs and symptoms are very, very serious. Okay, so this is the post-birth warning signs checklist, and this is from the Association of Women's Health Obstetrics and Neonatal Nurses. They designed this to help us identify problems quickly for women who have recently had a baby and what to do about them. So they use post-birth as the way to remember what issues are most pressing for us. So the first thing I'm going to talk about is the post conditions. The first one is pain in your chest. Okay, so we're talking pain right here in your chest. Some people will describe it as feels like an elephant is sitting on them. Some women will experience it as a sharp pain. This is something that is very serious. And these 4 symptoms under post are call 911. Okay? Okay, so pain in your chest is the first. Next is obstructed breathing. So another way to say this is shortness of breath. So what I mean by that is if it's difficult for you to get air in your system. So if you're just typically breathing at a gentle level and then you start feeling like you can't get a full breath in. Okay, that's what we're talking about, this obstructed breathing. A lot of times we will see the two of these things happen together, pain in chest and obstructed breathing. What we're worried about is a heart-related event. We're also worried about a blood clot that has been, going through your body and settles in your lungs. Those are 2 symptoms that can happen to women after having a baby because you've had the baby, you're losing blood, you're changing fluids. There's a lot of things that can happen. So even if you're a completely healthy individual prior, these are things that can happen. Okay, the next one is seizures. So this is uncontrolled shaking. The person's not intending to shake like that. A lot of times they will get very stiff and then shake. This is, again, a call 911 moment. We're looking at all of these symptoms as very, very serious for a woman after having a baby. Okay, and then finally is thoughts of hurting yourself or baby. Self or baby. Okay, this is extremely serious, guys. Okay, we know that there are quite a few people in the United States struggling with mental health symptoms. So if you are having those mental health symptoms prior to having a baby, once you have the baby, they can really, really exacerbate. Depression is the one that we've all heard about, but anxiety as well. So we see that a lot in our postpartum moms, that they are so anxious about doing everything right and taking care of the baby and taking care of themselves, and that it just becomes so overwhelming that they start to have thoughts of hurting themselves or the baby. This can be incredibly, incredibly serious. Okay, guys, this is a call 911 moment because we really, really need to protect our moms and babies. All right, so that is the post portion of our warning signs. Okay, I'm going to erase this, and then the next signs are the birth signs, and these are signs to call your healthcare provider. Now, what I want to say about these symptoms also is if you don't take care of these next 5 symptoms quickly enough, they can lead to the call 911 symptoms that we just saw earlier. So again, more stuff that's really important to pay attention to. So this time it's birth is the acronym we're going to use here. Okay, and this is call your doctor. Okay, the first one is bleeding. We know that after women have babies that we're going to experience bleeding. We have birthed the baby, we have birthed the placenta, we still have a really large uterus that's contracting and healing. So bleeding is completely normal. What's not normal for our bleeding is if we have a blood clot the size of an egg, or if we soak 1 pad per hour. So if we're bleeding heavily. The other thing that we'd be concerned about is if we're starting to have like a darker red blood and it turns bright red. That's another concern that we're looking at. These are conditions that we need to call our doctor. We're looking to make sure that women aren't bleeding too much or experiencing hemorrhaging. This can be pretty serious if we don't take care of it quickly. Okay, an incision that's not healing. Okay, after having a baby, you can have incisions in a bunch of different places. Cesarean births, you're going to have a C-section scar. Women may have an episiotomy to make room for the baby in their pelvic region. We also may have some tearing from having the baby. So these are all things that are going to be possible sites of infection. That's what we're looking for here. So with an incision, we want to make sure that that incision is close together. If you start to see gapping in that incision, that's something we're worried about. If we're seeing redness around the incision, so if here is your incision line and you have redness around like that, that's something that we're concerned. So if all this stuff is red around here. We're also looking at discharge. Is there any colored discharge, yellow or green? And then a foul smelling odor coming from there. All of those are possible signs of infection. You need to call your physician right away. Okay, red or swollen leg. So red or swollen leg, typically in your calf. This we're looking for signs of what's called a DVT, a deep vein thrombosis. This is when a blood clot has been circulating in your body and it settles in those veins in your legs. What you'll see is a red swollen calf. It will be painful and hot to the touch. I have also seen this in a patient who was African American. So I wanted to point out that there may not always be the redness because he had such dark skin that there wasn't as big of a color separation, but it was darker, but it wasn't red. So I want to make sure that that distinction is made. It doesn't have to be red if you have darker skin, but if you're hot, swollen, in general feeling those signs of heat, that still qualifies as something that you want to call your physician about. Temperature greater than 100.4. We're looking for signs of infection, very similar to, these other 3 right here. Infections can be really dangerous, so we want to get that taken right away. Mastitis is another problem that can cause a fever, so that's the redness and swelling of your breast tissue when you're breastfeeding your baby. So really pay attention to the temperature. And then a headache that doesn't get better with medication. So severe headache. This can happen sometimes after you've had an epidural. If the epidural wasn't placed exactly where it needed to be, sometimes this severe headache can happen, but it also can be a sign of blood clots that are floating around. We're just trying to make sure that we keep on top of these, health conditions before the woman has a significant problem and needs to be hospitalized. So these birth symptoms are call the doctor. Okay, now I'm giving you all this information not to scare you. I really, pregnancy and birth typically goes very well, but if things like this, if it's possible to know this information, to be able to do something about it quickly, then we can help our women before we even have to go down that road of hospitalization, you know, and just severe problems. So the more that people know about these signs and symptoms, the more we're able to take care of those women who have made it through the 9 months of pregnancy and then birthed a beautiful baby. So I hope that this information is helpful. Again, please share this with anyone who's pregnant, family members of a pregnant woman. I really think that we need to take the best care of our women who are bringing our children into the world. So thanks for listening and have a wonderful day.